Hello friends. So thank you very much for the enhanced support from you. We have crossed 6,000 subscriptions so far, and some of my videos has crossed 1.2 lakhs, and it's increasing day by day, maybe tens of thousands every day. Thank you very much for your ardent support. So today I would like to speak on sweating or hyperhidrosis, increased sweating. You know that 2.8% of the population suffer from increased sweating, and in some families, one third of the person are having excessive sweating. It means that if you have sweating, it's likely that your brother, your sister, your parents are suffering. It's more likely. Okay, so usually the sweating is to maintain our body temperature, but it can occur due to various normal as well as abnormal causes. The normal cause could be if you take hot coffee, tea after exercise, if you walk a lot and you come back, you get sweating. If you are tense or anxious, you like to be sweating, and your limbs and it will be cold and sweaty. Similarly, there are so many conditions which would cause excessive sweating. Primarily, this sweating may be due to a primary condition or a secondary condition. Primary means there is a focal or localized sweating in the hands, in the armpits or the axilla, or in the soles of feet. The secondary type is called the sweating all over the body. Sometimes it can cause a sweating on one side alone, the heavy body sweating. That would indicate a problem in the spinal cord or in the brain or brainstem, some infarct or some congenital or from birth into itself. Okay, there are many conditions which would cause excessive sweating, like problem in the thyroid gland, hyperthyroidism, or problem in the pituitary gland, hyperpituitarism, or problem in some other glands called adrenal glands, pheochromocytoma, or carcinoid syndrome, or some other drugs, many drugs, especially antipsychotic medication, tricyclics, SSRI, NSAIDs, many such drugs would cause excessive sweating. If you take some drugs called anticholinergics, it's likely that it can cause sweating. Many physical conditions like Parkinson's, cardiac failure, lung failure, or other postmenopausal area. Postmenopausal syndrome. That means after stoppage of menstruation in females around 40, 50, or 60 years. They are prone for this excessive sweating. For some people, if they take food and all get a sweating, it's called a gustatory sweating. There are many conditions. There's a genetic condition also. Familial sweating is there. Rayleigh syndrome is there. Primary dysautonomia. There are such conditions also there. Okay, so basically, they can also be caused by various infection like bacterial infection, viral infection, tuberculosis infection, fungal infection. Some infection can also predispose to excessive sweating. Certain malign condition, some tumors, especially lymphoma, is notorious to cause excessive sweating. And similarly, some tumors in the lungs that are prone for excessive sweating. And probably some adrenal gland or pheochromocytoma, carcinoid, these conditions are also prone for excessive sweating. Similarly, some intoxication or some poisoning, some mercurial poisoning, or excessive intake of various drugs, or if you are exposed to hot, humid condition, in all these conditions, it's highly likely that the person is likely to sweat more. So, how to go about it? First of all, you should know that whether the sweating is confined to one hand, both hands, or in the armpits or in the soles alone, or is it sweating all over the body. So, if it's all over the body, then you should find out whether it's a normal sweating, whether sweating is due to any of the conditions which I have mentioned, whether it's some physical problem, some emotional problem, psychiatric problem, any problem in the lungs, in the heart, kidney, Parkinson's, postmenopausal, endocrine, infection, drugs, toxin, whether any such matters are present. In those cases, you have to treat those basic conditions, like especially hyperactive thyroid gland. It's very common, very common, especially though those people come with the weight loss, prominent eyes, number of limbs, and loose stools and excessive sweating. They come with a if you handshake with them, you get a warm sweating. So suppose if the patient is tense and anxious, you get a cold sweating. So you have to find out the basic cause why the sweating is caused, whether it's due to some infection, inflammation, tumors, malignancies, drugs or toxins or something which is responsible for this excess sweating. If or diabetes, uncontrolled diabetes or diabetes causing hypoglycemia or such condition also prone for, or a sudden BP surge in carcinoid or pheochromocytoma, it's likely that the person can have sweating. So find out the cause, then treat those condition, and secondly, if patient is tense, anxious, counseling and other medications. Then avoid tea, coffee, alcohol, smoking and all, that's important. Then if it is confined to hand or armpits, then there are certain treatment options available. One is giving medications like oxybutynin or glycopyrrolate or something like that. This better to go to a dermatologist, a skin specialist, they would advise you more. Some tap water, you keep your hand under a fast running tap water. This would cause improvement in the sweating in some people. Then some aluminum products are also known to, it acts as an antiperspirant, it's also good for sweating. Some surgical procedure like liposuction, laser treatment, some nerve blockade and also good for as a treatment for that. One novel, very interesting treatment option is giving botulinum toxin to, if there is a sweating of the hands and soles or in the axilla or in the armpits, you inject at 1 centimeter interval. You 2.5 to 5 units of botulinum toxin in maybe 20 or 50 spots in the hands or foot or in the axilla after giving a nerve blockade, so that it would be less painful. That's a very good treatment option. That can be the effect can last for 3 to 9 months, especially for professionals who go for all sort of because it is almost vital to reduce sweating, especially students when because they can't write more because the pen would drip fall off, or there's prone for getting infection, fungal infection, maceration and all. So these are the various treatment options available. Drugs are available, physical therapy is available, liposuction surgeries and other things, and botulinum toxin. So let me conclude here by telling you that sweating is quite common. Usually you don't have to worry much, but if there is sweating is increasing day by day with some bodily symptoms like weight loss, anorexia, fever, fatigue, malaise and all, or high blood pressure, or some eye problem, or some swelling of the thyroid gland and all, you have to check whether such things are there with that patient, or look for any other problem, the heart, lungs, kidney, malignancy, any drugs or infections, or whether it runs in family. So everything you have to take into consideration. So it is treatable, and especially with the newer modalities of treatment. So thank you very much. Bye. Have a good day.